Welcome to our instructional video where you will learn how to handcraft antibiotic cement-coated intramedullary nails. Indications include but are not limited to intramedullary osteomyelitis, infected non-union, and high-risk open fractures. The materials necessary for the procedure are listed below. In summary, they include bone cement, an antibiotic cocktail, perfusion tubing from a smart perfusion pack, a cement gun, and obviously an intramedullary nail of appropriate length for your patient. Please note that the size of the perfusion tubing is indicative of its diameter, which needs to be slightly larger than that of your intramedullary nail. Additionally, the perfusion tubing diameter represents the final diameter of your intramedullary nail plus the layer of antibiotic cement. For best results, we recommend using the combinations of intramedullary nail size and perfusion tubing size listed below. First, you'll want to straighten the perfusion tubing using a finger reducer or the intramedullary nail. Next, you'll want to break the nozzle extension off of the cement injection gun. Now, you'll begin preparing your antibiotic cement. First, mix all of the powder components together. Next, add in the cement monomer and all liquid antibiotics. After mixing thoroughly, you will hand pack the cement into the injection tube and load the tube into the cement gun. Cut the perfusion tubing approximately 1 centimeter longer than your intramedullary nail. Inject all of the cement in the cement gun into the empty perfusion tubing. Insert the distal aspect of the intramedullary nail into the perfusion tubing on the same side you just injected the cement. While inserting the nail into the cement-filled tubing, use your hand to cap the end of the tube. This pressurizes the system and promotes even distribution of the cement around the nail. You will likely have to continue working the cement, as demonstrated, in order to achieve a more uniform coat of cement around the nail. As you can see, the insertion end of the nail does not have any cement coating. Make sure to avoid areas of thin or exposed nail. Next, you'll want to cut the perfusion tubing off of the antibiotic cement using a 10-blade scalpel. Take care to avoid delamination of the thinner coating of cement at the insertion end of the nail. Peel the perfusion tubing off of the antibiotic cement-coated nail as demonstrated. You can remove excess cement at the end of the nail using a ronger. Finally, bevel and smooth the end of the nail with a Bovie scratch pad. Your handcrafted antibiotic cement-coated nail is now ready for insertion. There are a few things to note regarding the insertion technique. First, you'll want to over-ream by at least 2.5 millimeters. This is to avoid cement delamination. You will also need to remove the ball tip guide wire from the canal prior to nail insertion, as the cannulated slot in the nail is full of cement.